Well, my friends, this is a case of a gentle lady, age about only 31 years. She developed an umbilical urachal cyst. ইউরেকাল সিস্ট কীভাবে হয়, আম্বিলিকাসের ওখান থেকে এমব্রায়োলজিক্যাল স্টেজের সাথে কী সম্পর্ক থাকে সেটা আমি একবার একটি ভিডিওতে বুঝিয়ে দিয়েছিলাম, সেটা রিল্যাপস করতে চাইছি না। However, the cyst, which is known as urachal cyst, was infected and operated. There are many pictures of operation, stage by stage. It was healed, but after that, scar formation or formation of keloids. For curing this recurring abscess formation, keloid formation, she went at Christian Medical College at Vellore, and this is the paper of the Christian Medical College. It has been clearly stated there is recurrent infected urachal cyst. At last, the condition is like this. The photography has taken by another mobile. There are large areas of the lower abdomen. This black portion is the umbilical portion. The whole part is full of scars and keloids, and there is one opening still which secretes pus or discharge or fluid. So this is the paper of the Christian Medical College of Vellore. They have declared recurrent infected urachal cyst, and they treated. They wanted to operate further, but in this way, 4 times operation already done. 4 times operation for recurring this urachal cyst. They performed 4 times operation. The lady is now in a state of great fear and anxiety, not only for operation of the urachal cyst, but some other conditions she had developed, such as one small calculus in the gallbladder, for which operation is essential, but she is not willing to operate for fear of this recurrence of infection and formation of keloids or scar tissues. So she is suffering in 2 ways. Number 1, the old scars and keloids are not healing, and number 2, developed gallbladder stone and some umbilical hernia once again. But if she operates, definitely she will suffer scar tissue formation disease and keloids. That's why he sent to me by one of our homeopathic junior physicians, Dr. Rakesh of Bonga. So this is the gentle lady, the picture of the gentle lady, a sober, medium height, obese, gentle lady, age about 31 years. So the present complaint is discharging of pus from the abdominal wall, discharge of pus from the abdominal wound for the past 2 months. I have already told she underwent urachal cyst excision with bladder cup So what will our prescription to check up this condition and to correct a select minimum single medicine? So the case taking is done by one of our junior homeopathic physician. She has taken nicely all the points, and I have picked up the main points like this. See, I have shown the figure, a little bit obesity. She is having aversion to sweets. মিষ্টি খুব একটা ভালোবাসো না বলেছ, না হলেই ভালো। So aversion to sweets, obesity, recurring scar tissue formation is a symptom of graphitis, you know. So aversion to sweets, graphitis, phosphorus, causticum, etc. And recurrent keloid formation or scar tissue formation. If you go through the Allen's keynote, it has been clearly mentioned in the graphitis chapter. Hard cicatrices remain, শক্ত হয়ে থাকে জায়গাটা। Hard cicatrices remaining after mammary abscess. এখানে বলা হয়েছে মেমারি গ্ল্যান্ডে কোনো অ্যাবসেস হচ্ছিল, তারপর থেকে জায়গাটা শক্ত হয়ে থাকে। So it may be explained or acclaimed or interpreted that any part of the tissue after operation may be hard cicatrix, and from the keloid portion there is still discharging from a particular point which is not thin, rather thick and sticky. ওখান থেকে মাঝে মাঝে যে রসটুকু বেরোচ্ছে সেগুলো একটু আঠালো বলেছ। So discharges are thick and sticky, scar tissue formation again and again, aversion to sweets. If we go through the Kent's repertoire in the chapter stomach, we will see that aversion of sweets, there is clearly mentioned graphitis in the first grade. So aversion to sweets, graphitis. Obesity tendency, তুমি কি আগে রোগা ছিলে, মোটা হয়ে যাচ্ছ আস্তে আস্তে, না বরাবর একই রকম ছিলে? তারপর থেকে মোটামুটি এরকম হয়েছে। So this medicine is the first line written in the Allen's keynote. It is suited to women inclined to obesity, আস্তে আস্তে obesity tendency দিকে যায়। So সেটা যে সম্পূর্ণভাবে খুব obesity হচ্ছে তা বলবো না, কিন্তু টেন্ডেন্সি তো আছেই। চিলি পেশেন্ট, শীত বেশি। গ্রাফাইটিস ইজ এ চিলি পেশেন্ট, takes cold easily and sensitive to draft of air. It has been clearly mentioned once again in the Allen's keynote and also in the repertory, takes cold easily and chilly patient like calcaria, hypersulfur, knock-bomb, etc. There is always the discharge, menstrual discharge is always scanty and late. It is also once again found here, the cycle is always late. There is history of suppression of skin disease. She had developed some skin eruptions in between the thighs, for which she had applied some external applications or lotions or ointments from the model dermatologists. So if we go through the Kent's repertory, there is a rubric in the skin chapter. See, in the skin chapter of Kent's repertory, there is a rubric, skin suppressed by ointments. Everyone knows the two main medicines, sorinum and sulfur, but there are other medicines too, and graphitis is also there. So skin diseases already treated by ointment, the patient having aversion to sweets, the cycles are always late, and on questioning On asking, on interrogation with her, I have observed she is mild-tempered. So the temperament of the patient is also important. Like pulsatilla, our patient is also mild and having yielding disposition. For chilly patient, please remember, my friends, for chilly patient in my repertory, which is going to be published, I have given the chilly, hot, etc. are separately very nicely and clearly. But in Kent's repertory, in the where we will see the chilly, the rubric chilly is not written or mentioned in his repertory directly in that way. It has written in the chapter generalities, cold in general aggravates. So cold in general aggravates means chilly, and see there is graphitis is a first graded medicine. So considering the whole symptoms, I mean the characteristic, the peculiar, the uncommon, the rare, the strange, the striking, by which I can make on portrait of the patient, and the portrait is graphite. The physical makeup, the cycle leak, recurring ulcer, recurring formation of scar tissue, I mean keloid, aversion to sweets, chilly patient, suppression of skin disease by using long continuing ointments. So I like to prescribe graphitis in 50 millismol scale of potency, my friend. Let's see the result. I shall share you the result after few months. Please remember this video number. With that direction, try it in a day, morning, noon and evening.